Hello, Leonie. Greetings from Geneva. How are you?
Hi, it's so nice to see you, Harv. I'm fine. I'm in Amsterdam. It's cold out here, but I'm happy to see you. But this is not live, but we will meet live at the IMCAS.
Dr. Leonie, well-known dermatologist, she's a specialist in the use of ultrasound technology for an even safer aesthetic performance.
Yes, and you are a plastic surgeon specialized in noses and contouring.
So we will take both part with other colleagues in the V-Sculpt Symposium by VIVACY in Paris at IMCAS. I will perform live injections in the area of the jawline and chin, explaining the use of stylage volumizers in a best manner. I'm really looking forward to have you by my side because I don't use ultrasound and with the ultrasound technology to ensure patient safety. So how this technology can help us, the practitioners every day, can they use it regularly?
I use it almost every day, not in all my patients. But for example, if you look at the jawline, people just don't follow the anatomy book. And some people, and you cannot tell up front, have a very small, less than 1 millimeter subcutaneous layer. And before you know, you end up injecting in the parotid gland, leading to abscesses. We had a very nice case just 1 week ago with a lot of swelling, and then the filler was not injected in the parotid gland, but it was injected just above the facial vein. The facial vein had a different course, and the filler was injected in the SMAS surrounding the facial vein, leading to a lot of swelling. So ultrasound can help you to dissolve and look where the problem is, but if you had looked before, then you would have seen that that was a very deviant core of the facial vein.
So I think they were a little bit deeper that subcutaneously to be under the SMAS. It's under the
exactly. It was here under the submandible.
And the mandible and the submalar or subgland and the parotid gland are really deeper than the SMAS. So if you stay under the skin, it's okay on the subcutaneous plane. So probably they were deeper.
They were much deeper, yes.
Yeah, they were not evident where the danger are. So if you know the anatomy, like me, like 30 years of surgery and injectable, but also you need to practice on cadavers and you have to perform thousands of injections. And chin and over contouring for many seems to be an easy assessment, but I will show you that is tricky, and it can be, and you can perform a safe, effective injection with stillage filler. And I think now you have to convince me that I have to buy an ultrasound.
No, I'm not going to convince anybody. But the thing is, yes, even for experienced physicians and doctors, they are not able to look into the head of the patient unless you do surgery. So yes, we do see that plastic surgeons are better in anatomy because they are really in somebody's head. And other physicians just have to deal with anatomy books and with cadavers. But just, patients are different. And a lot of physicians, plastic surgeons in the Netherlands, use it to have a look up front to see something special. But it's mainly the subcutaneous layer. So if you want to do a very superficial injection, you want to know the thickness of that subcutaneous layer.
Mm-hmm. Okay, so guys, if you want to learn more about the recent viscose sculpting technique, that's a new word, viscose sculpting, I like that, and about technology for injection to support a safe and effective treatment, please join us and our colleague from VIVACY Scientific Task Force at IMCAS 2023 in Paris. Dr. Leonie, maybe you want to add some words on the conclusion and to invite people to come to this symposium?
Oh, I just hope they all come because you're doing a great technique and you're going to show them the new contouring of the jawline. And I can show them the inside of what you did and how the patient is looking. So I hope to see you. It's Friday, 27 January in room 10.
Thank you.